Hello, good morning, everyone. Can take our seats. Okay, we're getting to the final day. Very excited. I think yesterday we will have an exciting day, different panels discussing a little bit of IT infrastructure, then go into One Health and surveillance, moving to workforce development. And then we did the breakup sessions where we all get the chance to go and explore the different working groups from PHA4GE and the ones that have been in the IPSN sample to data, discuss a little bit of the gaps and challenges to get actually the sample to data piece of the roadmap. So I would like to get back and remind us a little bit about the roadmap we discussed the first day and the 4 processes we are talking about. So we discussed sample to data yesterday in one of the breakup rooms, and we have been validated some of those deliverables and action areas that we were going to work together as a community. Data to insights, I think we have been discussing this through the whole conference. We have been discussing challenges in IT infrastructure, we have been discussing challenges in data sharing. Today we will focus a little bit on the third side, so insights to policy in different levels, and we will do it through the whole day. So we have different panels, one including to policy making in advances public health genomics, and another panel on founding. And with that, we can kick off the day. We will have a very interactive session after that, so you don't get to sit so comfortable in your couch yet. So enjoy this first part, relax, so then we can get some action. I think I can go to the next slide. So for this panel on policy making for advancing public health genomics, we will have a little bit of different speakers. So we will have Massab Umair, we give us a national perspective from Pakistan. We will have Sabrina Weiss from the Robert Koch Institute, that she will give us a little bit of perspective on some projects that we have been running in different countries, together also with IPSN. And we have Francis that will give us a regional perspective from Africa CDC. And I will start setting a little bit the scene, and I will go back to the 5 objectives of the genomic strategy. And I know you have been listening to this already, but I still have questions around, well, but what that is actually means. What do we mean to making genomics into policy making? Because we all say that. We need to make sure that we embed genomics into our public health system. We need to make sure that genomics is reflected in policy. And we have a very broader audience today, which is actually one of the milestones of this meeting, getting together the people that are doing the bioinformatic pipelines, the people that are making the tools, the people that are running some of the databases, the people that are on the operational side every day in the lab, the people that are running genomics programs. We have also the regional offices of WHO. We have Africa CDC. So we have a range of various stakeholders bringing together by PHA4GE and IPSN to have this discussion together, to make sure that we can bring all these perspectives to the table. So going back to the 5 objectives of the strategy, because everything we do has to be leaning to that. So how to improve access to those tools, and to improve access to those tools, we need to make sure that they are into the policy at the national level, at the regional level, at the global guidelines. Because it's not there are some sets of tools that they get published and used in the context of a project or in the context of a specific lab. So how can we really improve the access of those tools to make better geographic representation, make sure that all the countries are representing when we make global decisions? How we strengthen the workforce. Yesterday we have an amazing discussion around training and competencies and how we embedded that into the system, how we make sure that we have competencies when we need to hire someone in the public health laboratory that has and that can work to include genomic surveillance. How we enhance data sharing. And again, enhancing data sharing doesn't have one specific answer. So we have to tackle this in different layers. And policy is a big piece of that. I was mentioning on some of the sessions, for example, the pandemic agreement discussions, and how we can if we make it a policy, can change some of the things. How we can understand the policy that we have on data sharing in our own country, because of course there are limitations there. And I will ask you here in the audience, how many of you know the data sharing policies from your own country? And you can raise your hand. Okay, I don't see that many. I can say from mine. So this is quite important, because then all the discussions lose meaning, because we don't understand the legal implications. We don't understand the policies behind that. We are all sitting somewhere. Data is sitting somewhere, even if we're hosting data. What are the policies around the data hosting in that specific country? And these are discussions that we need to start having, and we need to embed it in all the other discussions. How we maintain the readiness posture for emergencies. And this seems like a very simple statement, but again, if we don't have a system, that has a policy behind it to sustain it, there is no way that we can have the resources ready for an emergency. You can mean a very simple example, and I will use my example with my previous role at WHO in a country. Unless we have genomics in one of our policies, that we are doing surveillance from one of our disease programs, we never have the way of advocating to have genomics reagents in our reagents list for getting them into the lab. So that's the level of detail we need to have in the policy. And just to let you know, in Argentina, for example, it was cholera. We don't have cholera as one of the priority areas, but it was the use cases that we can get genomics into our policy. And it's the way that we can apply for budget and justify having a service in place. How we can maximize the connectivity in the broader surveillance architecture. Again, this has to be embedded into policy. How we share data among countries. What are the legal implications about that? And in health and broader. So for that, we need to understand policy. We need to involve policy makings into that. And most important, we need to make sure that we get this into the global health agenda. Because we can keep discussing in this room, but unless we get it to the people that are actually negotiating all these policies at the national level and at the global level, it is very difficult. And this is where I think this joint meeting is so important, because we're trying to bring different works together. We're trying to make sure that every statement that we have from this meeting can get to the right channels and can get to the right people that can discuss and advocate for that. And if we only talk about the tools that we need and we only talk about how to do that, it's not going to get into the right audience to make that change valid. One of the reasons we were trying to craft this roadmap is actually to give you the tool, the way of advocating for this at the policy-making level. And policy-making for all of us will be someone different. It can be the dean of the university. It can be the director of the National Reference Lab. It can be someone at the Ministry of Health that's doing that policy. It can be WHO. So for all of us, it would mean something different, but we can use this to advocate for this, to make sure that this is part of the discussion. So when we think about the 3 strategic pillars to drive sustainable global pathogen genomic surveillance, first we mentioned how to institutionalize this through tools, policies, networks, and frameworks. And I know I said this on the first day, and I will keep repeating it today, and this may speak to some of you or not. And this is why we want to craft the day today and make sure that when we go to the breakout session, we can discuss this together with everything that you have in mind from you as a stakeholder. So how you institutionalize this into your own institutions, into your own world, in where you work in pathogen genomics. How we can really build this system together. How we can bring it to our agenda. And as I said, our agenda can be the dean of the university. Our agenda can be the founder we are applying a grant. It doesn't matter what your agenda is, but if you don't have a policy to reference, it's very difficult to keep advocating for this. So how can we make sure that genomics, it's in the policy that we have at our hands that we can reference to? How we can invest alignment and evidence-based advocacy to make it sustainable. Having genomics into policy is key. It's the only way we can keep advocating for this. And again, at all the levels of the agenda, national, institutional, regional, and global. How we can make sure that gets this into the founders, and founders as a broader understanding of funders. We're not talking about philanthropists. Our governments are founders as well. So we need to make sure that we get this coordination, that we make sure that we get the message there. And understand with robust and economic evidence why this is important. How we can coordinate these data ecosystems. Again, policy is critical here. We cannot forget the policy and the legal implications that this have. Creating an interoperable, trusted, and robust system that can connect local to global actions also needs to be embedded into policy. Even the policy of the data platform we're using, even the policy of whether institutions we are sitting in. So this is critical at all levels. So when we think about action areas that we can think for this, how we can support the global genomic guidance into national planning. And again, this may speak to some of you in different levels. But again, the national planning is how we craft our national priorities. And if we don't get genomics into those national priorities, there is no way we can keep it sustainable. And national priorities and how we get genomics into that will speak different to different countries, because countries' priorities are completely different. Again, you also have the regional priorities as well. And this is where we keep discussing different use cases and how that speaks to you and how that use cases can be applied. For some would be emergency response. For some would mean some disease that is on the higher burden in your country, and genomics can make a difference. But unless you don't have it into that national action plans, it's very difficult. How you advocate, how we all advocate to have it in those national plans, well, this is up to us, and all of us have a different role play in that scene as well. How we mainstream genomics into evaluation and training, and this is a little bit related to what we discussed in workforce, but actually how we evaluate and monitor those national plans, how we evaluate and monitor how we perform as a country, as an institution, and as a program longer term. This is also critical. We need to show with numbers that whatever we have in this policy is working and is making a change. And again, how we strengthen networks and coordination mechanisms. This is also critical, because we need to make sure that we work all together through the different networks. We all know the fragmentation. Fragmentation is at all levels. It's at the disease network level. It's at the, even here, fragmentations as different working groups, different people working in different ways. So how can we coordinate, and how we can include that coordination into a policy that can support us to move forward. How policy can be into investment alignments and evidence-based advocacy. Same thing, we need to generate this local evidence on cost effectiveness and health impact. But if we don't translate that evidence that we generate into something that can speak to policy, then it doesn't matter. It will keep there in the literature, we keep citing that, but we are not taking it to the next level. Align donor and national priorities, same thing. We need to make sure that we align the priorities nationally. We are all have the elephant in the room, that is funding. The global landscape in funding for global health, we all know the situation. I don't want to go into the details. And that will happen everywhere, every time. Now we are seeing the drop down from the pandemic, but this is cycle. All of us that have been working in public health for a long time, we know that we're always competing for funding. And this is at the national priorities as well. I mean, in the ministry health level, there are many priorities, and genomics is pretty much in the lower of that priority, except for very specific cases. So we need to make sure that we can get that into a very compelling case so that it can get into a policy. Then overcome procurement and supply bottlenecks. Again, what policies do we need to overcome this? Where we need to have regulatory agencies? Where do we need to have other stakeholders to have some policy that can support this, that can make, for example, interchange of material easy? And how we can coordinate the different ecosystem. And this is very speakful to all of us, how this can be lawful, ethical, and secure data practices. For that, we need policies at the different level. how we can build a trusted and connected global sharing model. And again, I will get back to the pandemic agreement, the PAP discussion. We need some policy at the international level, but then we need obviously policies at the national and regional level that can support this longer term. And this again, we need to know the policy in our own country. Sometimes when we are doing the operational work, when they are doing our research work, even when doing a report from the lab and to inform genomics results, we don't think about that. We don't have it in our mind, but we need to have it. We need to cite those policies that apply to us every time we do that. How we can ensure reliability, comparability, and interoperability of national systems. We have been discussed a lot about interoperability, about data standards. Again, how we make them into our national plans, how we make this part of the policy. And sometimes this is as easy as getting a line that when we have to apply genomics for a specific disease, need to be in this standardized way. And that is already a policy. That is already there. That is something that you can cite. That is something that we have some accountability for as a country, and we need to comply with that. When we think about the target outputs, I won't go into the details now because I will go into the details during the session, but I want for you to keep it out there. After the consultation we have, as I said, we started in 2024. I saw a timeline, I put a timeline there yesterday, I didn't put it today. Oh, my slides are not moving, sorry. I've been talking by myself. But what we put in those timelines and what we put in these timelines is because this is a set of consultations. So all of these target outputs has been consulted. Many of you have participated on those in different levels through the communities of practice, through the virtual consultations, from the in-person meetings, and we are today to keep consulting this to this audience. So if we think about action plan toolkits, if we think about workforce competency frameworks, how pathogen genomics can be integrated into training and evaluation frameworks, and I will discuss, as I said, in detail when I will explain the session later, how we can implement guidance and costing templates, for example, how we can implement a research consortium, investment case repositories, funding landscape mapping, country case studies, essential reagents list, all of the things that can be applied to a policy, can be cited, can be used for, and can be used by you as a community to advocate for pathogen genomics. And of course, we can think about legal and benefit sharing templates, tools on platforms, endorsements, processes, data governance and policy models, pathogen genomic standards repositories, and federated analysis implementation. And again, these are some target outputs. We will discuss in the interactive sessions and during the breakout rooms this in detail. But I want you to have this in mind. I don't pretend for you to remember this, don't worry. We will print and have it in your breakout rooms. But think from your perspective, from you as a stakeholder in this bigger community, how this speaks to you, how you can make a difference, and why policy is important. And I think what I asked at the beginning, how many of you know the policy in your countries regarding genomics? There are not many hands up. So I do understand that sometimes when we come and speak about IPSN, a lot of you said, well, I don't understand what we are talking about. Why are you putting this into this joint agenda that we have been developing with IPSN and PHA4GE? Because this is important. This is the way we can advocate. This is the way of getting sustainability. And hopefully, during this panel, we will continue discussing that. And I think that's my last slide. And with that, I will invite Massab Umair, that he will be speaking about strengthening national preparedness, the development of Pakistan pathogen genomics surveillance strategy. To stage.
Good morning, everyone. I am Massab Umair. I'm working as a Principal Scientific Officer at National Institute of Health. So today I'll share Pakistan's journey of developing its national genomics strategy for priority pathogens, highlighting some of our challenges, our progress, and our vision for 2025-2030. So the first National Genomic Strategy of Pakistan was developed early 2023 through a structured and a collaborative process. So we first developed a technical working group at National Institute of Health. And this technical group used the WHO's genomic surveillance strategy for pathogens with pandemic and epidemic potential as a guidance to align with global best practices. And based on that, this technical working group performed a SWOT analysis of the strengths, weaknesses, opportunities, and threats to analyze the genomic capacities in human health sector in Pakistan. And with the findings of the SWOT analysis, the first genomic strategy of Pakistan was drafted. This strategy was then shared with the National Laboratory Working Group for their review and technical inputs. And after that, this strategy was also shared with IQLS for validation. And lastly, this strategy was endorsed by the National Institute of Health, and this strategy became available in February 2023. So while the 2023 Genomic Strategy of Pakistan was a milestone for us, but it was still a very foundational effort, and we realized there were several gaps while implementing this strategy. Number one, for the SWOT analysis, we did not carry out on-site assessments of the genomic capacities in our human health. So much of the work was done, much of the data was gathered remotely. So there was, no real-time information or information about the existing capacities at that time. Secondly, there was no structured method used to prioritize pathogens. Although we included most key human pathogens in that strategy, but there was no systematic framework used to rank the pathogens based on their public health importance, based on their epidemic potential or cross-sectoral relevance. Thirdly, there was no implementation plan developed for the strategy. So although the strategic objectives or the strategic directions, they were very clear, but there were no implementation plan. There were no timelines defined. There were no stakeholders was defined, and there was no method of how to monitor the progress of this implementation. And lastly, this strategy was focused mainly on human health. So there was no integration of One Health. So animal and environment sector, they were not part of this strategy. So keeping in this mind, we decided to develop this strategy, which is more inclusive and which is more evidence-based. In 2025, we started this revision or update of the 2023 strategy, and we used a three-phase approach. In the phase one, we developed structured survey tools to assess the genomic capacities, infrastructure, workforce across the three sectors: human, animal, as well as environment. And using this survey tool, we carried out on-site assessments of the genomic or the sequencing facilities in these three sectors across Pakistan. And the findings from these were used to perform the SWOT analysis. And the result of the SWOT analysis was then added as new strategic objectives in this revised strategy. The phase two was mainly about consultation and about strategy refinement. So in the phase two, we conducted or convened a multi-sectoral workshop. So we had participants from human health, from animal health, from environmental health, and as well as from academia and international partners. So they were all part of this multi-sectoral workshop. So this group basically, it reviewed the 2023 strategy and the phase one work that we did. And based on that, they prioritized samples, they prioritized pathogens for genomic surveillance. And for this, we used a structured way. We used the Asia-PGI tool for pathogen prioritization and under the One Health framework. And also this group, they developed a detailed implementation plan. So they define, different strategic action, sub-activities, timelines, who is responsible to do what. And lastly, this strategy was again shared with our National Laboratory Working Group for their review and inputs. And finally, this strategy was shared with our Ministry of National Health Services Regulation Coordination for endorsement and approval. So I'll just quickly go through some of the strategic objectives. So the revised strategy under the objective 1, it basically centers or it focuses around equity of access. So ensuring that genomic capabilities, they are available across the regions of Pakistan and across the 3 sectors. And to achieve this, we are going to develop a national genomic consortium. So it will have representation from the 3 sectors, and we are also, at the subnational level, we are going to develop our provincial technical working groups. And these provincial technical working groups, they will be basically coordinating genomic activities at the provincial level, and so it will also strengthen local ownership. We are going to do a national level mapping of the genomic capacity in Pakistan, and based on the findings from that activity, the National Genomic Consortium and these provincial technical working groups, they are going to advocate for financing and for integration of genomic surveillance in ministries and provincial health departments. So under the objective 2, we basically, it's about, it focuses on, first of all, building and then sustaining skilled genomic workforce in the country. And we all know this is extremely important when we talk about surveillance systems. So to achieve this, we are going to train and retrain our bioinformaticians, our scientists, molecular biologists, and data managers. And to get to that point, what we plan to, make exchange. We're going to have an exchange program where people working in the 3 sectors, they are going to share their expertise or their knowledge or best practices with each other. Apart from that, we are also planning to develop a One Health Genomic Fellowship, so which will have a structured training, which will have mentorship, and which will also have competency-based learning. So under objective 3, it basically emphasizes about strengthening data sharing and utility. So the purpose here is to make sure that the genomic data is translated into action for public health. So to achieve this third objective, we are going to establish, first of all, a national genomic data depository for Pakistan, so that will store and manage pathogen genomic data from the 3 sectors, and this will be led by National Institute of Health. In addition to that, we are preparing a real-time genomic dashboard that will be integrated with this data bank, this national repository. So health authorities, they will have they can visualize the outbreaks or how the pathogens are evolving. Under the 4th objective, it basically again emphasizes connectivity when we talk about the overall surveillance architecture of Pakistan. So it ensures that the genomic data, it flows seamlessly across the systems, across the 3 sectors. And for this, our main priority is to integrate our genomic data into DHIS2. So the health authorities, they have real-time access to not only the epidemiological data, but to the genomic data. And the last, in the 5th objective, is basically about preparedness. So making sure that we are prepared before an outbreak. And for this, our National Genomic Consortium, it will be playing a very key role, and we also plan to establish rapid response laboratories that will be equipped to maintain, sequencing search capacities for high-risk pathogens. So these are some of the, objectives that we have, drafted in our national strategy. Okay, so now our focus is on implementation and sustainability as we move forward. And to achieve that, the immediate steps are, we plan to integrate genomic surveillance in routine health budgets. We plan to execute the phase implementation plan. And thirdly, we plan to establish the data platforms for integration of genomic data at the national level so that the laboratories across the country are linked to each other. So there were a number of learnings when we developed this strategy for Pakistan, but I think these learnings can be used by global community who are designing their own genomic frameworks, and I'll share some of the key learnings here. So first of all, we realized that multi-sectoral engagement was key, involving the human health, animal health, environment sector at the outset was very important. Secondly, we realized that data-driven planning, which is based on on-site assessments of genomic capacities, it is very important, provides a foundation for national goal setting. Thirdly, early engagement of ministries, our policymakers, our decision makers, we realize it's really important for two reasons. First, it has a governmental ownership, and secondly, it ensures that your strategy, it aligns with the national priorities. And lastly, we realized that maintaining flexibility and mechanisms for regular review is important so that the strategy is responsive to emerging or evolving science and technologies. So with this, I would like to thank our Ministry of National Health Services Regulation Coordination, NIH, AIDS Healthcare Foundation for providing financial support for revision of this strategy, PHA4GE for giving us access to that prioritization tool. And before I finish, I'm really excited to share that just yesterday, my book got published. So it is pretty much what we have been discussing here. Thank you. So it's about my journey throughout the pandemic. So we have been discussing how we can use genomic data to inform policymakers, to inform public health decision making. So I have discussed all that, how we use genomic data, to achieve these targets in Pakistan during COVID pandemic, then during Mpox emergency, then for dengue and for so many other viruses. And I have also discussed the importance of laboratory leadership, the importance of collaborations, multi-sectoral engagement, and a lot of my personal experience of briefing at the National Command and Operations Center and how effective communication, it's important to advocate at the highest level. So all this is in this book. So if you are interested, this is available on Amazon, so you can read it. So thank you so much.
Thank you, Massab, for that wonderful presentation and for being a published author lately. Okay, and now I invite to the podium to Sabrina Weiss from the Robert Koch Institute. She will talk about, let me get here, sorry, it is divided into 2 pages, challenges and opportunities in operationalizing genomic surveillance in Africa.
Thanks, Josefina, and welcome from my side. I'm going to talk about a project, and you see the title here, which is a partnership to strengthen integrated genomic surveillance through greater capacities in national public health institutes. And since nobody can ever remember this title, we kept calling it the IGS project. And we were working with 5 countries, largely building on existing partnerships that we had already, which is Cote d'Ivoire, Namibia, Madagascar, and also the Gambia and Ghana. The Ghana is given in parentheses here because the results I'm going to present today do not include results from Ghana yet. So the aim of the project is to improve decision-making for public health through the expansion of national genomic surveillance capacities. And as the title said before, there's a really large focus on the national laboratories. The project has several work packages that you see listed. Today, I will focus on the policy work package, which is really aimed to raise awareness and to really ground informed policy decisions and analysis. So the aim of this work package was to explore challenges and opportunities in operationalizing genomic surveillance. What we did is we did literature reviews of, the scientific literature, but also of existing policy documents of each country. For Namibia, our approach was slightly different, and we did a foresight exercise there last year, and there's a poster, I think it's number 44, if you want to know more about this. Please feel free to approach us and have a look at the poster. For the other 3 countries, we did 57 semi-structured in-depth interviews, really speaking with people, with experts in bioinformatics, epidemiology, laboratory, science or health policy, including the politicians, but also technical experts. We also included international stakeholders, and that was representatives from WHO, from Africa CDC, but also from other regional initiatives. And in total, we did 15 interviews in Côte d'Ivoire, 23 in Madagascar, and 19 in the Gambia. The topic guide and the coding strategy and also the analysis was informed by the IPSN country capacity framework that most of you might have heard of already. To analyze, we did largely deductive coding, speaking of these categories that you see listed here that are based on the capacity framework, but then we also complemented it by inductive coding to also gather the information that were not known to us in advance and to get the new information out of that. And I will now very briefly give you a snapshot of the first results that we got from the analysis. The first category was on governance, and one of the most outstanding things was the lack of core budgets and the donor dependency that was very evident in the countries we were working with. And what that means is that the public health use of genomic depends on external donor funding, but that is also very largely related to ownership for obvious reasons. So there was a really big need to develop public health strategies for genomics to really secure the governmental and domestic funding for that, but also to strengthen and decentralize capacities. Because in reality, at least in the countries we are working in, the academic institutions might contribute to genomics, but they are not formally part of the system. So it's always based on negotiations and renegotiations to really include them and to really adequately leverage their capacities that are there very often. And that's true for academic institutions, but also other research institutions that are present in countries. Looking at human and physical assets, and we have heard a lot of it about this yesterday, there's still a lack of trained workforce, specifically for bioinformatic analysis and interpretation, and there's still very few opportunities for continuous professional development, and also the aspect of limited access to reagents and consumables, which are still higher in costs and difficult to issues in supply chains. And however, despite those limitations, in all the countries we are working in, there's really a good basis that we can build on. But it also became evident that despite the fact of training that's needed, and as you can see here, one of the participants said, we don't need to create new biologists, we need to train those who are already in place. So we need this workforce development, but we also need really career paths that are available, because reality in the countries we work in is that there's still people who do the genomic work are usually involved in their routine work, which might be like regular molecular diagnostics or bacterial diagnostics or whatever. So we really need these dedicated career paths in the countries. The third category was process management and continuous improvement, and that really refers to the need for frameworks that was identified by all the 4 countries. So really the wish to have a strategic plan for sustainable public health use of genomic surveillance, but also the legal frameworks, and we've heard a lot about that already, that many of them don't know how they can use the data, how they can share the data, and so on. So there's really a need to work on these legal regulations. When it comes to data analysis and decision making, what we saw is really a lack of data sharing platforms at the country level, and that really hinders public health actions that's based on the data. So there's simply no way to integrate the genomic data with the existing surveillance systems, and that's one thing we are working on, to make sure that the data can be linked to individual case-based surveillance data. And what was coming out in consultations with our partners was that there is a wish for joint data evaluation meetings between laboratory and epidemiology, and I think that's also what we heard yesterday, and that using genomics analysis will increase the trust also in the genomics, in the laboratory reporting. And the last category is stakeholders and networks. And there it was evident that laboratories in the countries we are working in are often not involved in the design of the national surveillance system or in the national genomic surveillance system, and that there's really, really limited awareness among politicians. So very often they don't know about the results before they are published, and they don't really know how to use the data and what genomics can do. So I think this is also something that we've discussed already a lot, that we also need to educate politicians and decision makers. So to improve that, the participatory approach in strategy development may guarantee expertise and secure ownership and commitment also. And that really we need to advocate for strengthening genomic sequencing capacities to decision makers, and that this requires the support from across country stakeholders, but also from international partners. So in summary, we saw some contextual differences, or we know there are very substantial contextual differences, in fact, in the different countries we're working in, but there's also a lot of commonalities across the 4 project countries, and I think that's also a bit, again, what we saw during this conference. So there's still a lack of core funding and the dependency on external funders, and one thing that we've heard also was, okay, how can we base our decisions on data that's not owned by us? So this really is a substantial factor in our experience that hinders the decision making. There's a lack of country-level strategies and governance frameworks, so to make sure the data can be really used for public health decision making, and of course the need of coordinated and sustainable training opportunities, and also career paths, so really have dedicated positions for people to work on genomics in the laboratories. However, I mean, the public health use, it's not genomics, is not new, but the use in public health and the application in public health, I think, is still in early stages, and there's really good opportunities to build on, and there's really good existing laboratory and surveillance systems to build on also in partner countries. And there's really an opportunity to still enhance inter-stakeholder collaboration with countries and also internationally align all the interests that are existing there. And with that, I'm going to close, and I would like to thank the partners in the country specifically, but also most importantly, Anne and Lenka, who really did most of the policy work here, together with Caroline and Daniel. And yeah, I would like to thank all the team and you for your attention. Thank you.
Thanks, Sabrina, for those presentations. And now we will invite to stage to Francis Chikuse to talk about policy and action and integration of genomics into existing public health frameworks in Africa through development of national strategies.
Good morning, everyone. My name is Francis Chikuse. I'm a Senior Technical Officer for Public Health Policy at Africa CDC. I'm based in Addis Ababa, Ethiopia. So today, I'll take you through the journey which we have traveled in assisting countries to develop their costed national genomic strategy document. I'll give a brief overview of Africa CDC. As we are aware that Africa CDC was launched in 2017, and then in 2020, we also had Africa PGI Pathogen Genomics Initiative, which was also launched in response to COVID-19 mainly. And then I think my colleague on Monday also mentioned now that we now have PGI 2.0, which was launched in Zambia in 2023. So in 2024, also there is discussion to have also to launch Africa CDC Institute of Genomics, which also involve human genomics and precision medicine. And I think this is also very key because as we have seen in other countries, they are also advanced in terms of their human genomics and also precision medicine in addition to pathogen genomics. So the capacity for genomics has been increasing within the continent. As you can see from 1829, 48 countries, they had no NGS capacity in public health laboratories. But for 2023, we now have countries which have got increased capacity with also centers of excellences. And we hope that by 2026, no country will be left alone. My presentation is going to be made easy because most of the aspects they have been already been shared with previous speakers since Monday. But how then do we integrate genomics within the existing systems in Africa? What are the lessons learned? I think the why part has always been explained. We need to enhance our public health systems. We need to enhance our emergency and preparedness, and also the surveillance system, and countries which also have human genomics. Then I'll move on to the way. We have been working with 21 countries so far, which we have assisted, and some of them we are continuing to assist them. And most of these countries, they are in white. In the northern part of Africa, central part, eastern, western side, and also the southern African region. So the way which we have been conducting, we have had a stepwise approach where we started with a regional workshop, invited 15 countries, that was in Lusaka. And then we wanted countries to share their experiences and also to build some community of practice, because we realized that countries, they have common problems. So they also have to have solutions. Then after the regional workshop, we'll also now conduct individual countries. We started, like I said, 15. And then we emphasize the need to have a collaborative approach to genomics, also vis-a-vis addressing the real challenges. And I think we have had a lot of valuable lessons. Initially, the approach was the One Health approach. We invite the One Health ministries. But as we realized, as we had a lot of a consultative approach within member states, we also realized that even the police, they were also involved in genomics, and they were also involved in development of these national strategies. Mainly, they are also involved in forensics, and also to address one of the critical problems in terms of supply chain, the customs. We also had to involve the ministries responsible for customs, and for obvious reasons, the Ministry of Finance. And I think there we learned valuable information, because some ministries, they only thought genomics was for COVID-19, and it was there. But after those meetings, and then they are away. And then we, during this development of these national strategies, we're leveraging on two valuable resources. I think the first one has already been the global one by WHO has already been presented to you, but it was also a good resource. Then we also have the continental one, the Africa CDC pathogen genomic surveillance policy framework. And this document was very, very crucial because, one, it was validated by more than 40 member states in the Africa. So they gathered together and validated the document to say, this is what we want for Africa, and this is what we want to include in our national strategies as well. So the continental one, it has got 7 priority areas around capacity expansion, which has already been mentioned, as well as workforce. Not only the development, but what was also key for the continent was also the retention part, and also the leadership, coordination, and governance. And I think we have heard from a previous speaker from Pakistan, then they had to form the genomics, National Genomics Consortium, and also all these member states which you have assisted. Another area which we really assisted them was to form this National Genomic Consortium, and also the framework, how they are going to work, what are the roles. And this, the consortium also has got different stakeholders, with each having different roles. Another key priority area also was on supply chain and also access, including financing, and putting more emphasis on domestic financing, and lastly, on data governance. Like I said, I will not dwell much into the global genomic surveillance strategy by WHO. It has got 5 objectives, and I think they have been shared with you. But what came out as key during this process was to have the guiding principles for these national strategies. And the most key one, which were also emphasized, was the ownership. Countries, they took the ownership. When we went there for in-country workshop, they were the ones who were doing the facilitation, the ones who were doing the moderation, taking charge of the development process. Us as Africa CDC and also key partners were also there. We were only there to provide technical support. So this is where the ownership started. And then we even emphasize that these are the national documents, not even for us as our key partners. And then also other key guiding principles, which have also already been shared by my colleagues, is also these strategies got mainly the public health focus, and also multidisciplinary partnership, issues around equitability, as well as sustainability, data governance, One Health approach, and emergency preparedness. So what has then been the impact of Africa PGI? So since 2024, 6 countries have developed, finalized, and launched their national strategy documents. And I think some of these countries that are here, I've seen representatives from Malawi, they have launched. Recently when Mozambique, they launched on the 3rd. Ghana as well has launched, Nigeria has launched, Ethiopia, I have seen also some colleagues from Ethiopia, they have also launched. And then we also have 11 countries who have finalized, and they are now going through the processes in terms of launching. And then from that list, I know very well on Monday this week, Rwanda has also indicated that they want to launch on the 11th December. But in between that, I expect we are still working with the other countries to also launch their national strategies. And then we are still working with 4 other countries to finalize their work. And that's a picture just to show the Zambia National Genomic Strategy document, as well as the consortium framework. These are the meetings, various meetings which you have had, regional workshop involving many countries, as well as the in-country workshop. So, what has been learned? The first one is coordination between regional bodies like Africa CDC and other in-country partners like Global Fund, WHO, US CDC, CHAI. They are very, very critical to develop a robust and a comprehensive national strategy. In all the in-country workshop, we would make sure that all those partners were also there to provide support to the member states. What is also key is you have to ensure that you maintain strong national leadership and also good political will, with also politicians, as well as key ministries, like I've mentioned, that we have to have a number of ministries involved so that we can have buy-in at an early stage. This national strategy, mainly they focus on public health, decision-making, and target all the priority pathogens, whether at national level or at regional level. And there is need to strengthen data management and promote data sharing and collaboration. There's need to strengthen coordination, and I think I've mentioned that this is mainly through the National Genomics Consortium, which has got various technical working groups, and also to conduct situational analysis and SWOT analysis, and I think that has been also mentioned, and also having clear objectives, missions, as well as an approach for strategic implementation. This is very key. And you need to come up with a costed implementation plan, which has got timelines and also those people who are responsible, as well as robust M&E frameworks, and also resource mobilization plan. So in terms of the target for implementation, these are the key areas in terms of the capacity. And I think after the situation analysis, we have realized in those countries which we have working with them, 21 of them, mostly now, in terms of capacity, mostly have got sequencers. It's no longer a gap. But they still have other areas where there are gaps, like in terms of also data storage, and also even the workforce development. We need to target various actors, not only those who are working in the lab, but also in terms of how can epidemiologists be trained also within this genomic work, as well as the policymakers and also the leadership, because these are the key people who are going to make policies. So in all our trainings, there are also going to be also some work and activities aligned to that, as well as a supply chain. I've mentioned that they need to conduct the customs official. What we have learned in most countries is, in terms of supply chain, the issue of customs is the major challenge. In some countries, they are tax exempted, they don't pay any tax, but the process is very cumbersome. It may take 3 or so 4 months before those whatever you have given the countries they are cleared. And then in some countries, they are still pay a lot of tax. I remember one of the countries during our MPOX response, we gave them reagents which were worth about 100,000, but they were required to pay 110,000 US dollars in terms of tax. So these are some of the issues which now, when the countries engage the right authorities dealing with customs, these are also discussions which, how can we minimize the time for clearance, and also what can we do about the issue of exorbitant taxes on laboratory commodities, including genomics. And I think also there's a huge gap in terms of quality management systems, and I think a lot of countries, they have taken cognizance of that. And then in terms of data governance and domestic financing. So as Africa CDC, as the next steps, we want to ensure we assist the 4 remaining countries to finalize and also launch their document, and also for the 11 countries, they also to assist them to launch their national strategies. So these national strategies, they are anchored on the sustainability as core for development, and this is something which we have always been discussing, and it has been addressed, and we will continue working with countries to make sure that sustainability is also, the issue of sustainability is also addressed. But one of the key gaps which we identified during the development of national strategies is when it comes to costing. The available tools which are there, one, they are not meant for multi-pathogens, and 2, as a continent, they don't address our key supply chain issues. For example, as you are aware that in Global North, the cost of doing genomics is lower. So when you do the costing in the continent, we also have to factor in that in terms of the actual cost. So I think going forward, if we can have, we can work with other key partners. We have got experience in developing the genomic costing tool for multi-pathogens, specifically for the continent. I think it has been mentioned that we need to move towards domestic financing, and I'm glad to say that it is something which Africa CDC has been taking it seriously. Now, recently, there has been a world division which has been formed solely to support member states in how can they come up with this domestic financing for health. They also, so Africa CDC has developed a simple yet powerful booklet titled Rethinking Health Financing in the New Era. And this booklet provides clear guidance to African Union member states on how to rethink and strengthen the health financing strategies. It is also anchored on areas like policy research and advocacy, the economic modeling, strategic guidance, as well as innovation in financing, including the blended finance, and also how can we tap also into other innovative financing models like the diaspora bonds. And I think one of the issues which came out clearly, what also other countries they are thinking in terms of increasing the domestic financing for health. They call it the syntax. This syntax is taxing on goods like alcoholic beverages, cigarettes, as well as sugary foods. And I think, yeah, this is also one thing which we have also learned. I would like to acknowledge the National Public Health Institutes, National Reference Laboratories, who were very instrumental to make sure that we have a coordinated, collaborative approach in developing these national strategies, as well as the funding from the World Bank and also the Gates Foundation. I thank you.
Thank you, Francis. If you want to take a seat, we will invite Sabrina and Massab for a couple of questions that are from the audience. We are a little bit over time, so we will try to keep it to the burning questions from the audience. Peter? Yeah.
Thank you to all of the speakers, and so much to learn from. But I've got a question specifically for Sabrina. What you said overlaps with what Torsten said yesterday, which is that our tools need to have outputs that we standardize in a standardized way. You're talking about capturing the genomic data, and I think you might not mean capturing the genomic data. I think you might mean capturing the results of the genomic analyses, right? What do you see as the key results that we need to capture? Because I think we can, and then what databases, where do you think they should go in terms of being able to reuse this data within our public health programs?
Yeah, thanks. Yeah, you're right. We need to capture the results. I think on a very practical level, what we see, and I hope I get you correctly, that the systems that are used on the greater surveillance are very often still paper-based. They are very often not case-based, so often it's aggregated data, often it's paper-based. So getting this into a digitalized form and making sure you can link the cases. So it's really, in my experience, it's really a matter of communication and getting really the basic results, and then obviously, again, what you said, translating that and making sure the data can be used on further. But right now, at least in most of the countries we are working with, there's not even a possibility to link what's captured in the surveillance system, in the normal surveillance systems, with the lab data. So it's very basic still at some instances. I mean, it's it varies across countries and across institutions, but we are talking really basic.
Yeah, my question goes to Massab. Talking about integration of sequence data into DHIS2, how do you see this feasibility, given that sometimes sequence data can be very ambiguous and storage can get complicated for systems like maybe DHIS2? How do you see this working out, and probably exploring other databases could be also maybe appropriate in this case?
Yes, thank you for that. Yeah, you are right. It's not that simple. You know, it's a challenge. But you know, first of all, at the moment in Pakistan, we are adding our lab data to that system. But for genomic data, first of all, we need to ensure that the data that is being generated, it has a certain minimum quality, and for that, obviously, again, we need to we need to develop standards for lab protocols and then for the bioinformatic analysis. Once we have that, I think the integration will be a little bit challenging, but yes, we can do that, I think.
Thank you. And one last question. Yes.
Thank you. My question is for Massab and also for Francis. Really enjoyed the talks about the national strategies, and I think what really struck me was how clear the key actions were and the deliverables. I guess the question is, who holds the responsibility for delivering? I mean, there's a lot of things to do, and I guess how do you divide up that responsibility and make sure that progress is made against the strategy?
So in Pakistan, sorry, I am unable to see you. So in our case, so we have given that responsibility to the National Genomic Consortium. So it will be that body that will oversee the entire implementation of the strategy in the country. So because it will have representation from the 3 sectors. So we believe that National Genomic Consortium is the right authority to oversee the implementation of this strategy in Pakistan.
Yeah, thank you very much. So for us, for the member states, mainly like you have said, the National Genomics Consortium, they are very, very key in terms of coordination, governance, and leadership. But now, when it comes to the implementation, we have various strategic objectives. Like, for example, if you are talking of workforce development, yes, we need the National Genomic Consortium, but the academia also, they also have to be responsible. But when you're talking of supply chain, we also need other ministries responsible, customs as a key, as stakeholders. The same applies with financing. So it's just that countries, they sit and then see who will be responsible and for what. And there's also an M&E framework which the countries has also developed. Thank you.
Thank you very much for the 3 speakers, and thank you for your talks and everyone from your questions.